Hello everyone, my name is Muhammad Ghozy Tsabitul Azmi, and today I want to talk about something very important in medical studies: how we report research clearly and honestly. In medicine, it is very important to trust the results of studies, especially when they help doctors decide how to treat patients. This is why the consort statement is so helpful. For my English oral exam, I will explain the main parts of the consort checklist 210. I will use a real study, a randomized control trial, as an example. This presentation will help you understand what consort is and why it is important and how its rules are used in actual research. To guide you, I to guide you through my presentation, first I will define the consort, then I will go through its key items one by one, and then finally I'll summarize how well our sample paper follow the checklist. By the end of this presentation, I hope you will clearly understand how to check by the quality of a research report for a randomized control trial using the consort guide. First of all, what is a consort? Why it is important? Let's begin with understanding what consort is for. Okay, consort means consolidated standard of reporting trials. It's widely accepted guide that help authors write reports of randomized control trial for publication. Its main goal is to help authors report their studies fully and clearly. This makes it easier for readers to understand and judge the result. Today, I will explain 25 items that has been in my article. Uh, so, and before we going through each part, let me explain the structure of this checklist. First of all, uh, we can use we can see this section 1 is title and abstract, then introduction, methods, which going divided by parts, and then results, discussion, and other information. Okay, first we will see item number 1A is identification as a randomized in title. In the article, the title says a randomized control trial. This is a correct and clear example for consort. And then this is in page 1, and we can checklist on table, and then we continue with 1B. I found this as a structured summary of trial design methods, result, and conclusion in the abstract. This is abstract. Uh, this is for example correct, and we checklist on page number 1. And then we next to introduction. There is a background and objective. There is two parts, 2A and 2B. 2A is scientific background and explanation of rationale. This is what I found in my article, or research article that I found. This is part of 2A, scientific background and explanation of rationale. The introduction talks about global burden of diabetes and why health coaching might be more effective than visual education. And then item 2B is specific objective or hypothesis. This is it clearly says that the goal is to improve healthy diet and reduce HbA1c through health coaching. What I found is this sentence. Our hypothesis was that the participant having the health coaching intervention so keep their diets more in line. And then we next, and then in section 3 we have methods, which is trial design. This has 2.3a and 3b. First, 3a is description of trial design, such as parallel factorial including allocation ratio. So the design is this study involved 6-month coaching intervention in a two-arm randomized control trial approved by the Institutional Review Board or IRB. So involved two arm like two type 2 group, which is intervention group and control group. And then N2B is mentioned. And then let's continue in 3A, which is a description of trial design including allocation ratio. In this article says it is a two-group with parallel randomized trial. Like this sentence is 3A is, which is description of trial design including allocation ratio. And then we move to trial design, which is 3B. Important change to method after trial commencement such eligibility criteria with reason. In this article, the authors say they did not change the plan. And then we continue to item 4A, which is the paper must say where the study happened. It was done in hospital Thailand. This hospital in Taiwan. Oh yeah, I forgot. The paper must say who can join the study. So the participant is around. Okay, for A is this. The participant must be patient between 20 and 75 years old with type 2 diabetes for at least 1 year and an HbA1c of 7% or greater than the past 6 months. And then next, we move in item 5, which is the paper must describe what each group did. So this the intervention for each group with sufficient detail. One group got health coaching, and then the other group got normal care. So this, and then we move to 6A. Item 6A, the outcome must be clear. The main outcome is completely define primary and secondary outcome measure. This coach would ask participants to set an HbA1c goal and behavioral challenge to focusing healthy diet. Then we move to 6A. The outcomes. We move to 6B. Change in outcome must be reported. So, and in this article, the authors said that there were no change in this study. And then we move with 7A is sample size determination. This article says they use a method to find a change in HbA1c with power of 80%. And then for 7B, this article says when applicable, explanation of any interim analysis and stopping guideline. This article says there is no reporting about 7B. Then we move to 8A, which is method used to generate random allocation sequence. This article using a computer generated random number. And then we move to AP, type of randomization and any relaxation. This article randomization by randomly assigning them. So it's like randomly we don't know what's in intervention group or what's in control group, and then this article does not have any restriction in the study. And then we move to 10C, 8, 9, which is mechanism used to implement the random allocation sequence, such as sequentially numbered containers describing any step taken to conserve the sequence until intervention will assign them. So the item 9 is the paper says the doctor, patients, and analysts did not know the group of assignment. So it is random choosing by randomly person. So the next is then item 10, who generate the sequence and enroll participant. So uh, the article says two physicians did both generate the sequence and enroll participants. And we next to number 11A. 11A, if turns was planned after assignment to intervention, thus assessing and how. As you can see in this, like I said before, the mentioned physician, participant, and analyst were blinded. They did know what what in this group, and then we move to item 11B, which is if relevant description of the similarity of intervention. So the article says no. Yeah, this article was not discussed about mention and similarity of intervention. Then we move to 12A. 12A is statistical method used to compare group for primary and secondary outcomes. Nah, this is statistical methods used for primary and secondary outcome. Is a pair t-test was used to assess difference in the HbA1c level and ANCOVA. And then we move to 12B, which is methods for additional analysis such as subgroup analysis and adjust analysis. So, nah. So methods for additional is multiple regression to test the correlation between coaching intervention, change eating behavior, and HbA1c within 6 months. Then stop. And we next to number 13A. For each group, the numbers of participants who were randomly assigned received the another treatment and were analyzed for the primary outcome. So this a diagram is strongly recommended. So a diagram like this. Nah, two group, which is intervention group and control group, is so these two group is filled by 60 and 60 by participant. And then we move to 13B, losses and exclusion after randomization. So the intervention group has lost to follow-up over 3 months. So the two participants has lost to follow-up over 3 months. And then control group has lost 4 participants to follow-up over 3 months. And then we next in 14A, which is that and defining the periods of recurrent and follow-up. So this is item 14A, test of requirement and no follow-up, which is between October 200, 2019 and February 2020. And then we move to 14B. 14B, why the trial ended or was stopped. Uh, this trial has not claimed stop the study. The study not said about what should. So in item 14B, this article did not mention about stopping the progress. And then we move to item 15, which is give a baseline characteristic. So this is item 15, baseline demographic and clinical characteristic. So this is like a baseline value of study group. And then we move to 16, which is give numbers analyzed. So the total of participant here, so the total is 58 plus 56. So we combine this and we got 114 total participants that complete the study. And then we move to item 70A, 17A, give a result for each group. So 17A. So the result of intervention group is significant decrease of 0 has the significant decrease in HbA1c. Then here ANCOVA with method ANCOVA test has the same result, which is decrease in HbA1c. And then we move to 17B, which is so effects, size and precision. So the 17B confidence interval and p-value are reported just like this, p below 0.001. And then we move to item 18. The report extra analysis. The regression shows that diet change help improve HB1HC. And then we move to item 19, reports of harms. In this article, there were no reports about harms. And then we move to section 5, and then in the discussion, which is in item 20, discuss limitation. This article has limitation about period when COVID-19, and then limitation about eating habit of different race, culture, and region, the dietary counseling method, and analytical result of the study may not be directly applicable to Western countries. So it is not it's not applicable about in Western countries. And then we next in item 21 generalize the finding. So the author says the finding could apply to similar hospital. Mean this study can apply in the other hospital. And then we move to item 20 and 2, which is must the result to conclusion fits the findings. The study that help housing may be an effective way to improve the HbA1c and the dietary behavior of patients with type 2 diabetes. And then item 23, trial registration. Trial registration is in here with ID number. This is it. And then Item 24, protocol access. This article has not available. And then item 25, funding the resource. Uh, this article has funded by Ministry of Science and Technology, or MOS of Taiwan. And then let me now summarize everything and we have talked about. This article has followed almost all key points of control checklist. The report was clear and honest. Most of the checklist was followed, although the study did not share the full protocol and the founder's exact role was unclear. Uh, to finish, the consort checklist is more than a rule. It's a tool to make a research reporting better and clearer. It helps doctors, patients, and researchers trust and understand research findings. As students and future professionals, understanding concept helps us evaluate studies and support better healthcare decisions. Thank you very much for your attention. I'm now ready for your questions.